Hey, Dr. Rob Davidson here, Executive Director, Committee to Protect Medicare, doing our semi-regular installment of a response to the Coronavirus Task Force press conference and just sort of thoughts for the day. And I'm joined by a great guest, hopefully not a guest going forward, really semi-permanent person on this, Dr. Callie Cyrus, a board member with Committee to Protect Medicare, also a psychiatrist in the Washington, D.C. area. I'll let Dr. Cyrus introduce herself and we can kind of get right to it.
Yeah. So I'm a psychiatrist who practices on an ACT team. So I go out to folks' homes who are the sickest of the sickest, been kicked out of other clinics. I practice part-time, and any other part of my time, I do some consulting in diversity and strategy.
Awesome, awesome. And I'm just as an aside, thrilled you're working with the Committee to Protect, thrilled you're on the board, and excited to have you here. A lot of what's been out there, a lot of what happened during press conference that I guess we can just start with is the whole notion of testing. We've had a lot of mixed messages from the administration talking about how much testing they're doing, how we do the most tests of anyone in the world, and that's somehow an achievement, and we can just sort of rest on our laurels. I know for myself, I'm concerned about the lack of testing and our ability to safely open up without testing every sick patient, every one of their contacts. And I think that should be the number one goal of the administration right now is to make sure we're pushing tests out and the reagent and the swabs to be able to do the testing to the states, to the communities, so we can safely open, get our economy starting to recover again. I know you had some specific thoughts on that related to what you do, and I'd love to hear them.
Yeah. So my aspect with my thoughts on the whole testing is I'm worried about the asymptomatic cases and the people who don't have access to testing. I try to think, just as a psychiatrist, the other side of the argument, which is at least it's impossible to have enough tests for everybody who might potentially be sick. And so I imagine if that's one side of it, then the other side is, okay, so what are we doing instead of testing? And the lack, I think, of education that's just been around. What happens if you are someone who may be asymptomatic, who came into contact with someone and you don't have access to a testing, and you're just kind of out in the world doing this, and people in your families or in your community are not following any kind of protocol. And we were talking about how as a psychiatrist, my psychiatric nurses are actually more essential than me. We go out to folks' homes. And so I've been calling everybody, but the nurses have been going out and giving injections. So most people can take tablets by mouth, but there's some people who are on long acting depot injections because they won't take their medications at all. And this is the thing that keeps their housing or, keeps them being able to work. And we had to close out our office because one person tested positive, although people weren't showing any symptoms. And I just am imagining how many different homes someone could have gone to during this time. And my patients will, unfortunately never, if they don't show any symptoms, will never know if they were exposed and the people in their homes, and they can't articulate this. And so I just think the lack of direction around, even if you're not being tested, what you can do, and how the asymptomatic sort of population is just floating around, spreading the disease to immunocompromised people that end up in the hospital.
Yeah, and I think if you look at three different data points related to asymptomatic carriers or asymptomatic individuals, one is a hospital in, I think it's the Bronx, that tested all women coming in labor. And out of all the women who were tested, asymptomatic women, 14% tested positive.
Wow.
I think a homeless shelter in Boston testing, they had 40% of individuals who were asymptomatic tested positive. And in Iceland, who has tested the most individuals per population in the world, they're estimating up to 50% of their population potentially asymptomatic, and yet carrying and potentially transmitting the virus.
Exactly.
And so, I mean, that just it tells us why this is different than anything else that we've ever encountered, different than Ebola, different than SARS, that were very symptomatic. You could identify cases within a day or two and isolate them. We are flying blind. So yeah, I think it does tell us why so much of the energy of so many of us is spent on figuring out this whole testing regimen. The other thing I know that has been talked about a lot, certainly in New York and all over this country, I know here in Michigan, how this disease seems to be disproportionately affecting persons of color. And I know you wanted to specifically speak to that. I'd love to hear what your thoughts are.
Yeah, I mean, I think that when people, recite this statistics, it's not that surprising. I think we're all kind of used to the impact of diseases like this really being a burden on either poor, low income, or people of color. But there's just something about it, the disproportionate amount of the black population, specifically in your state, in Michigan. And I just think it goes back to education. And it's not just going to be the black population, it's going to be the rural population as well. So in thinking about the transmission of the disease, especially with the asymptomatic cases, is that people are going home to their family. And if you have hypertension, you have high blood pressure, you have, asthma, you have COPD, you smoke, you're obese, you have diabetes, automatically your immune system is not responding in the way that it should. But what's worse than that is that if you're in a state that has a poor infrastructure of healthcare, where do you go? So what helpline do you even call to find out like if you needed testing? And I mean, and that's the thing, is that we're really focused on testing, which is very important. We were really focused on the ventilators. Like I don't want to diminish the importance of these things, but then there's, in the absence of having them, which is reality, folks aren't being educated on what to actually do after that. And in places where that education is already not there, or doesn't happen, or there's not, medical providers or hospitals, just think about rural areas whose hospitals have been closing. Where are these people going? And so it's not surprising that it's a population that has the poorest resources that are falling ill to this. But it just, it's upset for me, at least in I'm going to say Republican states, or states that have not expanded Medicaid, that makes me the most worried about this.
Yeah, but I mean, Michigan has expanded Medicaid, and we're certainly not immune to the these social factors that impact people's health. And I do think that more than anything, this virus is shining a big bright light on all of the disparities in healthcare that have existed and have been unfolding for 4 decades, since the kind of profit mode of healthcare really got into full swing in the 80s, and it's just happening in like hyperspeed. And
Yeah.
so
I was when this all started, my mother said to me, well, they're saying Black people can't get the disease. And my mother is not like a heavy consumer of news, and she saw this on YouTube. So this meant that it must have gotten to her via text or something. And that was my cue. And I think that goes again to what populations are disproportionately sort of impacted by this. And it's the ones that don't have access to education, that family members who are coming in the house might say, Mom, that's not true. Like, luckily my mom has me to tell her that. Doesn't mean she listens to me.
Yeah.
But I think that's exactly, even in states like Michigan that have expanded, where, we're already bad at explaining the science behind how people get sick. We're not very good at it. And then that's what ends up happening to the populations who get the worst trickle down of information.
For sure. One part of your background that is interesting to me, and with respect to this whole disease, is sort of the mental health piece, both for, I won't say patients, but for the population at large, but also for healthcare workers. I mean, your nurses who are going out into people's homes,
right?
Me and my staff who are seeing people when they come into the ER, when the rest of the country is being told, stay in your house and don't go out, we're all kind of going out. And I don't know if you could speak to what you are seeing and hearing out there, and words of advice for folks.
Mm-hmm, mm-hmm. Yeah, so I think the mental health, what's been important for me to sort of reiterate is that no matter where you are on the front lines or even on the sideline, is that everyone is impacted right now with their mental health. Even if we don't think that it's getting to us, it's definitely getting to us. On the front lines, I mean, and not just physicians, nurses, respiratory therapists, I can only imagine the psychological toll of not even knowing if you should come home. I think all the stories that I've been hearing of people who are sleeping in their garages, of folks who had closed on a house and then decided to keep the house while the other family is in the new house. Like, luckily they have those resources to go to. I can't imagine some of, thinking of the income of physicians, but the income of respiratory therapists who may not have options like that to accommodate with their family, and they just have to go home. Right. I think there are precautions you can take, but that is not knowing that you could infect someone in your family who may or may not, even if they're young, still end up in an ICU. And so I think it's just important to realize that even wherever I mean, recognize your privilege, first of all, depending
Yeah.
on what access you have, and that not everyone can say, I'm going to stay home, or I'm going to, even physicians, if you decided not to, if I decided I'm not essential in this way, I don't have to go in, but I also have sort of the income to be able to do that. If I was a respiratory therapist or someone who wasn't making as much, I would have to go in. I would have to
Yeah.
risk my life. I can't say, no, I don't have that equipment. But I also think, I've been in touch with some of my friends who are in the artist community, who lost their jobs, right? Who are at home trying to apply for grants that have dried up. Like if you're talking about the small business grants, and I think what I'm seeing a lot of are people who are either really lonely at home alone, and they're getting really anxious. I have some of my clients who are worried about substance use. They're drinking and using more because there's not much else to do. My intellectually disabled patients who don't fully understand what's going on. I had a client say to me, "Oh, you just don't want to come visit me. Did I disappoint?" And it's tough. I have some patients who can get very physically aggressive, kind of like on an autism spectrum in this way, and intellectually disabled, and not being able to go to the bowling alley or leave the house to go to the park and do some of their normal activities. They've more aggressive than usual, ended up in the psych ER.
Right.
And so it's just like everyone is having their own experience at home, and it's super stressful. And it's like, no matter what you open or what you don't open, it's still, I just wish people understood why the shelter in place and why getting tested and why all this is important, rather than just this rule of you need to stay in or not stay in. But
Yeah. And
yeah,
that's such a big reason why I know our organization and so many of us are calling for testing, 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 because we know it is critical that we get opened up again. It's critical. Like no one is going to argue with President Trump I know in our state, Republican legislature pushing hard, but they're basically saying open, 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 but they don't want to come up with the plan or take the responsibility in how we do that safely, because I'm also seeing significant number of people come into the ER with anxiety or with symptoms that end
yeah,
up being what probably is anxiety, because they're afraid of the virus. They're afraid, that they opened up a piece of mail and what if I didn't wash it off enough, and what if I caught it that way. People are just terrified because in fact, this is a virus that's likely 10 times deadlier than the flu, and we have no immunity and probably won't for a couple of years. And
yeah,
so, yeah, it all, to me, it all goes part and parcel. And for once, I can agree with the president and with our Republican legislature that, yes, the mental health piece is important and it is a reason to open up, but it's just all the
yeah.
more reason to me why the testing needs to ramp up so we can do it.
Because people need information. In the absence of
Yeah,
information, people's anxiety and mental health concerns get worse. And I mean, this is the
sure.
thing: suicides have been on the rise now for years. They're higher than they've ever been. And so, it's we don't have a crystal ball to predict what's going to happen. But if you imagine how many people are in isolation, it's, for me, more so that they didn't have the resources in place beforehand. They
Right.
don't have the resources in place now. I think we can still expect that suicide rates will continue to rise.
Yeah.
It's just a matter of people not having any infrastructure to actually deal with it. And I'm hoping I mean, if there's a positive, like a silver lining to any of this, that people will just get in care. I've seen that the telepsych practice that I maintain is having like, my practice is now growing faster than ever. I was having people
Yeah.
trickling in at this point. So that's definitely a positive side.
Yeah, I mean, a disinvestment in public health, a disinvestment in healthcare in general, but certainly, probably more than anything, a disinvestment in mental health care has been just a hallmark of decades and decades. And maybe, like you said, a silver lining is we recognize how critical that is. We've been calling for it. When I, think about, policies I pursued, I mean, mental health to me is same as any other kind of healthcare, but too often it's put on a different level. It's put on sort of a side burner and thought of as something different. And I think this may help, again, shed a really bright light on that major dysfunction in our system.
I hope so.
I hope so. Yeah. Well, I tell you what, I'm getting the call here that we should start to wrap up. So I really appreciate you being here. This has been great. I mean, I like just talking with you offline because you're smart, and I trust your opinions and your thoughts on things that and maybe think about a little differently than I do. And I hope the people watching get that as well. And I hope we can do this again soon.
All right, me too.
All right. Thank you.
All right.
Bye.